Let me take you back to the early 1990s. When there was a Boston City Hospital, it was the safety net hospital for the entire city of Boston. It had always been in danger of closing. There had always been rumors about it being closed. And meanwhile, across the country, hospitals, municipal hospitals were closing right and left. Also, there were all sorts of mergers going on to be able to deal with the new issue at that time of managed care.
Boston HealthNet was formed in 1995, a year prior to the merger creating Boston Medical Center. There was a great deal of concern about losing the public mission to the populations that the old city hospital served. At that time, 8 health centers came together with the old city hospital and with University Hospital. And largely the interest was in covering managed care, which was coming to Boston, as well as forming a more tightly integrated system of care.
What's unique about Boston HealthNet is the variety of organizations it encompasses. It's a group of unique organisms that come together to create a very vibrant ecosystem.
One of the things that brings us together is the fact that we do have a common mission and that we do consistently serve a large, underserved, vulnerable population, and that, I think, helps us really align ourselves.
Boston HealthNet is virtually the only network in the country that is made up of health centers and an academic medical center, both vertically oriented as far as that affiliation goes and horizontally across all of the health centers. And there are no integrated delivery systems like that anywhere else.
What is unique about Boston HealthNet is that it's a safety net hospital partnered with community health centers, but they're not owned by the hospital, and so Boston Medical Center manages to bring together a very disparate group of health centers, very different patient populations, all governed by their own boards, and it's made into a cohesive whole, which is challenging.
So I think our partnership with Boston HealthNet makes Boston Medical Center a much better organization, a much better hospital. I think we're a better place to get care because the health centers kind of keep us honest. They're very clear when we meet their expectations, and they're very clear when we don't. And I think that's helped us, kind of challenge the paradigms of how we care for patients.
The network itself has probably doubled from the number of health centers to the number of patients served. During that 20 years, virtually all of the health centers have been rebuilt.
Many of the health centers have state-of-the-art facilities. We have evolved in terms of really offering a comprehensive set of services, so we try to provide one-stop shopping for the patients that we serve. We've improved our access, in some cases opening 7 days a week, expanding our hours, even access to urgent care services. And so those are all good changes.
So I think the major achievements of Boston HealthNet through the past 19 years have been to truly integrate care among the health centers and the hospital so that the very best care, excellence in care, is given to the populations that we continue to serve. We have a very robust electronic health record and quality reporting now throughout our network. We have been able to stabilize and assist with recruitment and retention of primary care physicians at a time when there is really becoming a dearth of those primary care docs around the country.
And over the past 17 years, we've really helped the health centers, our partners, to build teaching community health centers, where the doctors are part of a faculty practice, that they do some teaching, they do some research. There's continuing medical education for them. They have a career path. They're part of something bigger and better, and that together we're much stronger than we are alone.
The rounder system that HealthNet runs makes sure that we get information on our patients when they're admitted. They get admitted by a team that exclusively takes care of community health center patients, and then they communicate with us at the time of discharge, which, as we all know, is one of the more tricky times in terms of, transitioning care, reconciling meds, making sure that patients get a smooth transition back to their normal lives.
The Boston HealthNet Family Medicine inpatient service is among the best at Boston Medical Center now. Observed to expected mortality is excellent. We are admitting over 3,000 patients a year over the past 3 years. The throughput, the average daily time of discharge, the length of stay is among the best in the hospital. The readmission rates are excellent.
HealthNet has created a forum for people to share ideas and to learn best practices, and they've created a collective voice, which I think is a very powerful voice that this organization and state government and people around town need to listen to.
Early on, we had some fun and some battles and difference of opinions as through the various changes and funding crises we individually have gone through and so forth. I think that has allowed us to create a trust as we've worked through these issues, and I think that positions us well in the future.
It's a major success story that needs to be looked at by all of the other systems now dealing with Obamacare that are trying to figure out how do we make sure that people are disadvantaged get absolutely the same great care that they would get if they had commercial insurance or if they had insurance at all.
So I'm looking forward to partnering with our health center colleagues as we kind of ride the somewhat challenging roller coaster of healthcare reform and ending up back in the station with the healthier communities and patients that we can be proud to serve.
The uniqueness of Boston HealthNet is that we have begun 20 years ago preparing ourselves for today. We are right on the precipice in Massachusetts of a new accountable care payment system for Medicaid, which is the vast bulk of our population. No one has the kind of resources among primary care facilities that we have, along with a major academic medical center. And the future seems very bright for Boston HealthNet.